This is The Week in Addiction Medicine, a podcast resource of timely news and top stories brought to you by the American Society of Addiction Medicine, ASAM.
Today is Tuesday, March 31st, and I'm Zach Caruso. Our lead story this week is in the American Journal on Addictions and is titled Cannabis Cessation and Neurocognitive Recovery, Patterns, Predictors, and Clinical Implications, a Systematic Review. Researchers conducted a literature review of the neurocognitive effects of cannabis use and recovery from those effects. They found a range of neurocognitive effects including neuroreceptor adaptation, decrease in memory, processing speeds, and attention. Deficits increased with higher frequency and amount of use, but recovery can occur. Receptor normalization can occur within weeks of abstinence, while cognitive recovery can take months and years. Adolescent-onset users have more severe and persistent deficits, suggesting effects to neurodevelopment beyond reversible neuroadaptation. The authors suggest treatment for cannabis use disorder should focus on both the disorder and its neurocognitive effects. Next is an article in JAMA Network Open titled Treating Opioid Use Disorder with Methadone in Pharmacies. This study analyzed the return on investment for two pharmacy-based models for providing methadone, a pharmacy-based medication unit and pharmacy-dispensed methadone. The pharmacy-based medication unit describes a program in which a partnership between an opioid treatment program, or OTP, and a community-based pharmacy is established, in which pharmacists dispense methadone from the OTP medication unit located within the pharmacy. In contrast, pharmacy-dispensed methadone would require regulatory changes allowing medical professionals to prescribe methadone, which would then be dispensed from the pharmacy. The two models included startup costs and 3 years of operating costs and revenue. The medication unit model averaged 95 patients per month with a net profit of $3.53 per each $1 spent. The pharmacist-dispensed model averaged 22 patients per month with a net profit of $2.64 per $1 spent. Ultimately, the economic evaluation showed a positive ROI over 3 years for both models, indicating that leveraging community pharmacies for methadone access will be profitable if allowed by policy regulations. Our next article is in Drug and Alcohol Dependence and is titled Care Trajectories Among People with Opioid Use Disorder After Release from New York City Jails, a State Sequence Analysis Approach. This retrospective cohort study used matched NYC healthcare administrative data of adults with OUD who were incarcerated between May 2011 and 2014 to 2017 to examine care trajectories of community OUD treatment after incarceration. Of the 14,000 individuals eligible for inclusion in the study, 26% received in-jail MOUD. Using state sequence analysis, 8 different care trajectories were identified: continuous methadone treatment discontinuation, methadone treatment and reincarceration, methadone treatment initiation, continuous reincarceration, short reincarceration with little community treatment, long reincarceration with little community treatment, and no community OUD treatment or reincarceration. Receipt of MOUD while in jail was associated with belonging to the continuous methadone treatment group as compared to the no community OUD treatment or reincarceration group with an adjusted OR of 12.5. The study highlights the importance of in-jail initiation of MOUD. Our next article is in Drug and Alcohol Dependence and is titled Associations of Parental Smoking Throughout Childhood with Adolescent Smoking and Vaping, Mediation via Adolescent Substance Use Attitudes. Data for this study came from a previous longitudinal study of child cognitive development during preschool, 2006 to 2012, and follow-up during adolescence, 2017 to 2022. At follow-up, adolescents' attitudes towards cigarette and e-cigarette use were measured, as well as their use of cigarettes and e-cigarettes. Paternal smoking was significantly associated with both adolescent attitudes toward and use of cigarettes and e-cigarettes. Path analysis indicates that paternal smoking affected adolescent attitudes, which in turn affected smoking behavior. An unexpected result was that maternal smoking had no significant association with adolescent smoking. These results were similar for male and female offspring. Next is an article in the Journal of Studies on Alcohol and Drugs titled Social Media Portrayals of Nitrous Oxide Normalized Use and Encouraged Youth Exposure. Nitrous oxide misuse is widely visible on major social media platforms and often portrayed without risk information, potentially encouraging youth uptake. This study systematically reviewed 30 nitrous oxide-related videos posted between January and March of 2025 on YouTube and TikTok. Videos averaged 23 million views, 64,000 likes, and 9,500 shares. Half depicted personal experiences, 16% demonstrated use, and 10% promoted free trials. Most messengers were perceived as male and Black/African American. No videos included age restrictions or health warnings. Content frequently framed use as socially acceptable or entertaining. Public health strategies should include education campaigns, stricter regulations, and platform collaboration to reduce exposure. Our next article is in JAMA Psychiatry and is titled Psychedelic Therapy versus Antidepressants for the Treatment of Depression Under Equal Unblinding Conditions, a Systematic Review and Meta-Analysis. This meta-analysis of 24 trials assessed how psychedelic-assisted therapy, or PAT, compares with open-label traditional antidepressants, or TADs, in the treatment of major depression. Researchers found no statistically significant difference in patient improvement following PAT or open-label TADs. Open-label trials were associated with slightly greater patient improvement for antidepressants, but the same difference was not observed for psychedelics. These findings suggest that PAT is no more effective than TADs under equal unblinding conditions for the treatment of depression and highlight the potential role of blinding integrity. Next is an article in the Journal of Substance Use and Addiction Treatment titled Integrating Addiction Care in Hepatology: Impact of Liver Consultation on Post-Discharge AUD Treatment in Alcohol-Associated Hepatitis. Alcohol-associated hepatitis, or AH, has significant morbidity and mortality, and long-term prognosis for AH is associated with alcohol abstinence. Researchers conducted a retrospective cohort study to evaluate receipt of counseling, pharmacotherapy, and referral to rehabilitation for AUD during hospitalization for AH. Overall, 96% of patients with AH received counseling, but relatively few received referral to rehabilitation and pharmacotherapy. Patients who received a hepatology consult were more likely to receive referrals to rehabilitation. These patients were also more likely to receive pharmacotherapy, though this was not statistically significant. The authors note these findings support training for hepatologists and gastroenterologists to address AUD and integration of addiction services. Our final article is in the Journal of Addiction Medicine and is titled Liver Injury Associated with Kratom, a Systematic Review. Kratom is a topical evergreen tree in Southeast Asia. Mitragynine, its primary alkaloid, is a partial agonist at the mu-opioid receptor, and a metabolite, 7-hydroxymetagonine, is a potent full agonist at the mu-opioid receptor. A survey of U.S. adults estimates past year kratom use of 9%. The systematic review identified 31 case reports of liver injury associated with kratom. Resolution in several weeks of kratom cessation was documented in 69%. However, all cases required hospitalization and 4 cases required liver transplantation. In 3 cases, a re-challenge with kratom provoked a recurrence of liver injury. The pattern of liver injury was cholestatic, hepatocellular, and mixed. Kratom is often promoted as a natural pain reliever, but it does have risks. This concludes today's episode of This Week in Addiction Medicine. Remember to subscribe to the ASAM Weekly for more exclusive content and our editor's commentary delivered every Tuesday. Be sure to check us out on social media and at asam.org. Thanks for listening. We'll be back next week.